I'm Dr. Corey Maas on Looking Your Best, and today I was asked a number of questions, and I thought I'd just give a brief summary on how we manage scars. And really it's quite simple how we break them down, because scars are in different shapes and sizes and locations, and how we treat them varies according to a number of different factors. But really there are about 4 or 5 things that make scars noticeable, and we can address each of those individually or collectively to make a scar virtually invisible. Now, anyone that tells you there's some kind of special eraser of scars, or that the skin can heal without scarring, except in fetal surgery, has given you misleading information, let's put it that way. But we can make scars very, very difficult to detect, almost invisible, if they're done correctly. The main reasons that scars are visible are when the scars are not aligned evenly. In other words, one side is higher than the other, or the scar itself is depressed on the surface, or elevated on the surface, where the scar is overgrown or hypertrophic. So the alignment or the height or depression of the scar is one factor that we think is obviously very important, and it should be very smooth. The width of the scar, how far apart the two edges of skin are that have normal skin coloration, because scars themselves don't make color. They're relatively hypopigmented, or lighter than the surrounding skin. And we'd like to see any scar, especially on the face, be less than 1 millimeter. So a tiny little hairline scar, and very well disguised in a special place on the face, is what we're looking for whenever we're doing treatments, whether it's treating a skin lesion or something we don't want, or doing elective surgery. So again, the height or elevation of the scar, the width of the scar are very important factors. And the third one, which I've sort of alluded to already, is the color of the scar. Scars typically don't have the same color as the surrounding skin. In most patients, the scar will be slightly lighter. In some patients, especially in patients that have olive or darker complected skin, the scar itself might hyperpigment, which means it's darker than the surrounding skin. Now, hyperpigmentation of scars is something we can treat with certain creams and other treatments to lighten the scar so it more adequately blends with the skin itself. And so that shouldn't be as big of an issue. But when we have a combination of a hypopigmented or lighter scar and one that's wide, that's something that we commonly want to treat to make it much narrower and have a better color match to the surrounding skin. The other things that make scars noticeable, which would be intuitively obvious, is where they're located. It's a big difference to have a scar, for example, that crosses the nasolabial fold, this crease between the cheek and your mouth, diagonally, rather than a scar that follows right along the fold. And often at times, again, when we're designing ways of treating skin cancers or other lesions, or even doing cosmetic surgery, we're hiding the incisions for whatever treatment we're doing along a special crease or an anatomic boundary. Good anatomic boundaries along the face, or the sides of the nose or the ala, at the nasolabial fold as mentioned, and along the edges, the hairline, areas where there's a corner or triangle, are good places to hide scars or disguise them. So the location of the scar, particularly on a facial prominence like the cheeks, middle of the forehead where it's vertical rather than horizontal, these are areas where the position again of the scar are very important. So we've talked about the height or the alignment of the scar. We talked about the width of the scar, how far apart the scar would be. We've talked about the color of the scar. Does it match or not match the surrounding skin? And of course, we've talked about the position in general of the scar on the face. And the last one, which it sort of goes together with the other, is the general direction of the scar. I mentioned that to you before. It could be in a good location, but if its direction is bad, there are techniques we can do when we treat with scar revision that can actually change the direction of the scar and make it much less noticeable. One other basic principle about treating scars is that the human eye, has an ability to pick up things that are in line. So when scars are very straight lined, in a prominent area on the face, for example, there are treatments to help make that scar not so straight, to break up the straightness of it. Geometric broken line, Z-plasty, or running W-plasty procedures are options that we use to make a scar not so straight, not so regular, and make it much more difficult for the human eye to detect. So with all those things in play, there are a number of different options that we have to treat a scar and make it much less noticeable, if not quite invisible, but pretty nearly invisible in the average patient. And it's definitely worth it if you have a scar that you have somewhere on your body that you don't like, to have it checked out. I'm very happy to answer any questions, review photographs or video that you may take of your scars, and I think you really do have a good opportunity to make unfavorable scars look much better if we address the basic principles about what makes a scar noticeable. Again, if you have any questions, drmaas.com. You can go to our website at maasclinic.com, direct dialogue even on Facebook.com/Maas Clinic, or follow me on Twitter at Dr. Corey Maas. As always, it's my pleasure, Dr. Corey Maas, on Looking Your Best.